Have you ever considered that your heart, the very engine of your life, might be under a silent threat? Yes, a silent, invisible foe known as heart valve disease. This cunning adversary works in the shadows, disrupting the harmonious rhythm of your heart. It's a disease that affects the valves, the gatekeepers that ensure a smooth, one-way flow of blood. When these gatekeepers falter, the heart's regular functioning is compromised. Often, heart valve disease moves like a thief in the night, silent and unnoticed. It doesn't discriminate, it can strike anyone at any age. That's what makes it an unseen, universal concern. You might be wondering, how can something so significant go unnoticed? The answer is simple, yet alarming. Because the symptoms of heart valve disease are often subtle, it can go undiagnosed for years. Now, imagine you are one of the many who have been diagnosed with this disease. What happens next? You've been diagnosed, a whirlwind of medical appointments and tests ensue. Suddenly, you find yourself navigating the complex world of heart valve disease diagnosis and treatment. It's a journey filled with uncertainty, but remember, knowledge is power. Let's envision the journey of a hypothetical patient. Let's call her Jane. After presenting certain symptoms such as fatigue, shortness of breath, or irregular heartbeat, Jane's doctor suspects heart valve disease. The first step? Diagnostic tests. These are crucial to confirm the diagnosis and understand the severity of the condition. Jane undergoes an echocardiogram, a safe and painless procedure that uses sound waves to create detailed images of the heart. This enables the doctor to see how well Jane's heart valves are functioning. But sometimes an echocardiogram isn't enough. Jane might also need a heart catheterization. This procedure involves guiding a small tube through a vein or artery to Jane's heart. It provides the doctor with a clear view of the heart's chambers and valves and can even measure the pressure within the heart. Now, with a confirmed diagnosis, it's time to discuss treatment options. Jane's treatment plan will depend on the severity of her condition, her overall health, and her personal preferences. If Jane's condition is not severe, her doctor might recommend a watchful waiting approach, coupled with lifestyle changes and medication to manage symptoms. However, if Jane's heart valve disease is more advanced, she might require valve repair or replacement. These procedures can be done through open heart surgery or minimally invasive methods. Regardless of the course of treatment, Jane plays an active role in her health. She communicates openly with her healthcare team, follows prescribed treatments, and leads a heart-healthy lifestyle. Jane's journey from diagnosis to treatment may seem daunting, but it's important to remember that every step is taken with the ultimate goal of improving her quality of life. But with advanced treatments, the prognosis for heart valve disease has never been better. Let's delve deeper. After all, the journey to heart health is a marathon, not a sprint, and every step forward is a victory in its own right. Science has come a long way, and with it, hope for those diagnosed with heart valve disease. The world of medicine is constantly evolving, bringing forth revolutionary treatments that are changing the game for heart valve disease patients. One such advancement is the advent of minimally invasive surgeries. These procedures require smaller incisions, reducing recovery time and improving patient outcomes. Next up, we have biological prosthetics, valves made from animal tissue or even human heart tissue. These prosthetics offer a more natural solution, eliminating the need for lifelong medication in many cases. Last but not least, let's talk about transcatheter aortic valve replacement, or TAVR for short. This procedure allows doctors to replace a diseased aortic valve without open heart surgery, a major leap forward in cardiovascular treatment. With these advancements, heart valve disease is no longer a death sentence, but a condition that can be managed and overcome.